Hello, I'd like to speak about period problems during menopause or in the years towards menopause. What we mean by menopause is having had no period for an entire year, whereas perimenopause is a time when the woman is reaching menopause, so a few years prior to the menopause. In India, the average age of menopause is anywhere around sort of 48 years. However, if it is around 40 years, it's called early menopause, and if it's before 40 years, it's called premature menopause. Generally, a woman who's experiencing or going towards menopause has more frequent cycles or less frequent cycles, so it could be either way. However, if there is abnormality in the kind of bleeding with protracted spotting, prolonged spotting, or bleeding after sex, or very heavy periods, resulting in clots and flooding, etc., this would need a gynec evaluation. I generally tend to thoroughly examine the lady, having taken a thorough history, and then evaluate her for various hormonal problems, and also do a local examination to see if there's any signs of local estrogen, lack of estrogen, and vaginitis and atrophy. Also, I would evaluate the lady for fibroids and do a pap smear to look for cervical cancer. The most important thing to understand is these problems may be related to something called endometrial hyperplasia, which may or may not lead on to endometrial cancer. Hence, these situations should not be neglected, and a gynec evaluation is absolutely essential. A woman should undergo a pap smear every 3 years, starting from when she is first sexually active, and it should go on till the age of 65. Pap smear is essentially a very simple internal examination to look for abnormal cells in the neck of the womb, which may lead on to cervical cancer in a few years' time. If we did find any abnormal cells, we could treat it immediately. The other thing that we evaluate for is endometrial cancer. And endometrial cancer may or may not start off with heavy bleeding. Hence, we do a biopsy of the inner lining of the womb and look for abnormal cells, which may indicate a situation where there's a hyperplasia, and that may lead on to cancer. Hence, we need to take certain steps at that stage in order to prevent the progression to cancer. Thank you very much.